Well, welcome back to Good Day Sin-Law. Joining me right now is Weslianne Lewis. She's a registered nurse at Rapides Regional Medical Center, Women's and Children's Hospital. So thank you so much for being with us.
Thank you for having me.
Big month, August. August is the National Breastfeeding Month.
Right. It's meant to promote support for breastfeeding and access to information so that more people can be informed about it and then more likely to breastfeed their children.
Well, Weslianne, let's begin with the benefits. I know there's benefits for the mother as well as for the child, but let's begin with the mother. How does breastfeeding help the mother?
The longer the mother breastfeeds, the more protected she is against breast cancer and cervical cancer and also cardiovascular disease. So it's very beneficial to the mother.
And the longer you breastfeed, the greater your risk or removing the risk for.
That's right.
Is there a specific length of time that you
Well, the American Academy of Pediatrics recommends 6 months of exclusive breastfeeding, but if the child still wants to breastfeed and mother is still able to, of course, we would all medical professionals would like to see that.
And talk about the benefits to the child.
Of course, it reduces ear infections. For the child, children have problems with ear infections, also reduces respiratory illness, gastrointestinal illnesses, protects them from sudden infant death syndrome. That's a big one. And type 1 and type 2 diabetes, yeah.
Okay, and what is the benefit and the value of the skin-to-skin?
The skin-to-skin promotes, of course, the bond between the mother. Immediate skin-to-skin after birth actually helps regulate the infant's metabolism, which is really important. They were just born, they just learned how to breathe. This helps regulate the respiratory rate along with the heart rate, and of course their body temperature. Mother's body temperature helps regulate baby's body temperature. And it's a beautiful moment. Yeah.
And I know you're encouraging the support, so you're offering classes now. Talk about the classes.
Once a month, the first Saturday of each month from 9 to 3, we have free breastfeeding classes at the hospital. And you can sign up online at rapidesregional.com, or you can call us at 769-3445. And they are free, and we provide lunch.
Well, that's a wonderful opportunity for our community to learn more and the benefits and the value. Now, how long have you been a registered nurse at Rapides?
At 5 years.
It's been 5 years for you, and I know you have a passion for
absolutely,
for the
absolutely.
Well, tell us what we can do to help with the program. How can we help you increase the education?
Well, we need to talk about breastfeeding. We need to normalize it. If you see somebody breastfeeding, know that they're giving their child their very best. This is the very best food available for the children. This is a natural thing. We need to be supportive of mothers who are breastfeeding and family members who are breastfeeding and encourage them to continue on.
Now, after labor, the hospital is support 100 breastfeeding. So if you don't choose to breastfeed, what occurs?
Well, at Rapides Regional, we will support a mother's choice no matter what it is. Of course, we will give her all the information she needs to make sure that she's successful in her choice and making sure that the baby is able to latch or tolerate formula, depending on what mother's choice is.
Okay.
We're supportive of that 100%.
Well, I'm so glad you joined us and talked about
you.
the classes. Thank you for being with us this morning, Weslianne.
Thank you for having me.
Stay tuned. We'll be right back.